everybody, Dr. Kaylee here, pelvic floor physical therapist. I apologize, I don't have my tripod with me, so I'm holding it, but you can see taking a little break at the ocean today while I'm doing some mobile sessions. And I wanted to talk about something that comes up pretty frequently actually in my appointments, and that is the connection of the nervous system to the pelvic floor, specifically with pelvic pain with intimacy, and those kinds of things that we think about. But in general, just any pelvic floor dysfunction, how is the nervous system related? And when we talk about that, what do we mean? Because again, you see things floating around all the time, like calm your nervous system, do this somatic exercise to decrease your sympathetic nervous system overdrive. But what does that mean? And so there's two different systems in your nervous system, kind of three if you want to think about it that way, but like sympathetic and parasympathetic are the two general ones that we think about. Sympathetic nervous system regulation, that's pretty much where you're in like fight or flight mode, which a lot of us, especially with pelvic floor disorders, that's where we thrive. When we're thinking of the sympathetic nervous system, we're thinking of things like what is making us feel unsafe? What is making us feel triggered? What is our body telling us in these moments? So if we take pelvic pain, for example, anything that triggers that discomfort or anything that makes you think about that pelvic pain is going to automatically send you into feeling that kind of lack of safety. You're going to notice some tension in the jaw and the feet, down throughout the body. You're going to notice some overwhelm. Typically, anxiety will start to increase. Those are all things that you will notice that are quite typical for pelvic pain and pelvic floor dysfunction. And again, that sympathetic nervous system overdrive can show up as anxiety. It can show up as feeling hypersensitivity, frequency of urination, pelvic pain in other areas of our body, tension in other areas of our body. We see it impact and affect sleep. So you might be losing some sleep. You might notice insomnia coming up. You might notice a lot of worry coming up. You might notice, again, that like everything just feels overwhelming and unsafe all of a sudden. And again, that's quite typical for sympathetic nervous system overdrive, right? And so, sorry, readjusting here. So giving that the ability for you to kind of like relax into that and understand what that means. And what it means is that that sympathetic nervous system has been triggered, and it's gonna start sending you extra signals through the nervous system, meaning similar to like when you touch a hot stove. You touch a hot stove and you jump away pretty quickly because it hurts. That's what your body's trying to tell you to. And so when you have something that goes around the pelvic floor, you have anticipation of having a pelvic floor exam, you have somebody doing a pelvic exam, you have intimacy coming up, anything like that is going to feel a little triggering in that moment because your sympathetic nervous system is heightened and it's overwhelmed and it's feeling unsafe. So our job is, how can we make you feel safe, right? So again, that's that sympathetic nervous system overdrive. And that's the one that makes us feel like we have to run, we have to tense up, we have to, fight, whatever it is. We just feel unsafe. We're not feeling good in our body. Things to try in that moment are going to be breath work, different positions, tapping techniques, EFT. I see a lot of clients do really, really well with counseling, sex therapy, those kinds of things, because it really does help to kind of calm down the system. It really decreases that overdrive, and it helps you recognize those triggers to help to calm the mind in the moment when it's absolutely necessary. And then you go into the parasympathetic. That's the rest and digest. That's the relaxation phase. That's where we want to be to have sex or to do things without pain. That's what we want to do to decrease the pain, is how can I get to that rest and digest? And I find that clients understand what it is that they need to do. Like, we know breath work is going to be really helpful. We know that taking a walk is going to be really helpful. But for example, this right here with the scenery in the background, for me, this is a rest and digest moment. This is taking me out of sympathetic overdrive because I was really overwhelmed today. There's a lot going on, a lot of personal things happening, lots of things that need to happen that I'm not able to get done. My to-do list is overwhelming. So I come here to smell the salt water, to feel the breeze on my face, take a walk, hear the waves, to do these things because this calms my nervous system. A lot of times chiropractic can help to calm the nervous system, but you also have to have the other tools to be able to calm it down. Doing a little vagus nerve reset right behind the ear, relaxing the jaw and dragging down on both sides, that can be really helpful. Same thing, pull across the forehead, pull across the face. Doing different techniques like this can really help you get out of sympathetic into parasympathetic. Because again, a lot of our clients will come in and they're like, oh my gosh, I have an internal exam, I'm having pelvic pain, I'm having like internal pain, I cannot have sex, I can't insert a tampon. You're going to feel anxiety. That anticipation is going to be overwhelming. We have to know the techniques to be able to help you come out of that too. We have to be able to get you out of that feeling so that we can actually go through with our evaluation, whether that's internal, external, it doesn't really matter, but like even safety and movement, this means the same for that, right? Some people feel really unsafe with movement with a history of injury. We still have to know how to get you into that parasympathetic, that calm state, being able to kind of process through that. Lots of techniques to do that. My favorite one is using the breath. My favorite second is like environment. Like, what noises do we need? What visuals do we need? What do we need to remove to help you feel safe and calm? What is your body telling you? And like, that's one of the biggest things that I think is powerful for me and my healing. I've done a lot of this because with a history of vaginismus, sexual assault history, I have had to do a lot of the things that I talk about. I've been in pelvic therapy myself for many, many years because of the things that I've gone through, right? And so one of the biggest pieces of advice that I got in the very beginning that has been really just monumental for me is every moment that you can, or when you're feeling overwhelmed, or when you're feeling like stressed or anxious or worried, what does your body need? And asking myself that. At first I was like, I don't know how to know what I need. But what I've realized is I do. Sometimes I just need to let go of my jaw. Sometimes I just need to do a big breath. Sometimes I need to take a deep breath in. Sometimes I need to rotate my body. Sometimes I need to go on a walk. Sometimes I need to leave the chair. Sometimes I need to get in the car. Sometimes I need to get out of the car. And so little teeny pieces like that have really helped me to understand how to learn to regulate my nervous system. And I hope that you're able to take that today and recognize that that connection is doable for you. You are able to feel safe in movement, safe in intimacy, safe in pelvic floor therapy. And it's also quite common to not feel safe in the beginning, but finding a practitioner that can help you feel that way is so important. And that's a really big thing that we do at the Hope Doctors, is really understanding trauma-informed care and understanding how to bring that safety into every aspect of your care. But hopefully this helps somebody out there today. And I hope that you're able to find that relaxation and find a technique that works for you. As we continue to work together on here on this platform, I'll continue to share as much as I can. But make sure you send us a comment, send us an email, set up an appointment, whatever it is, if you're needing help with any of those things, because again, it's right within our wheelhouse. But have a wonderful day.